Hello, I'm Heather Back. I'm the Executive Director of the Medicine Hat District Health Foundation. With me today at the hospital is Dr. Mark Trudeau for the Cancer Survivorship Clinic located at the Riverside Medical Clinic. Thank you for joining us. Welcome.
Well, thank you, and thank you for having me today.
Let's begin with the basics. What is a Cancer Survivorship Clinic?
A cancer survivorship clinic comes from the success the medical community has of fighting back at cancer. As time goes by, surgery, chemotherapy, radiation are tools that came more refined, and the cure rate now of any kind of cancer, at least in the adult population, has increased. Therefore, once these treatments are over, the patient's journey is not over yet. According to your source of statistics, it is estimated now that in North America there might be close to 10 to 25 million people that have survived cancer in the last few decades. These people, we call patients, have different needs, and that's why this kind of a clinic has been struck in the last decade or so.
So this is the first of its kind in Medicine Hat. Is there any other clinics in our province?
Yes, there is, but for very limited problems in terms of sexuality. Alberta Health Services has in Edmonton at the Cross Cancer Institute, as well as in Calgary at the Tom Baker, a survivorship clinic where patients, mainly women, who are on hormonal therapy, post-cancer therapy. And as you may be aware, prostate cancer is treated mainly with hormone manipulation. This will trigger lots of sexual dysfunction, and there is this possibility for these patients to get better on their anti-cancer treatment at these two locations. The current cancer survivorship clinic in the Medicine Hat is not unique per se, in the sense that this kind of clinic exists in the other parts of the world. Yes, it's still a first for this community.
So I've had cancer, I've recovered from cancer, and now I can go visit you at the Cancer Survivor Clinic. What kind of services will you offer me as a patient?
In these clinics, the physician's goal is to make sure of the well-being of the patients once they went through their anti-cancer treatment journey. Most of these patients have received treatments such as chemotherapy or radiation therapy that may have impact on what we call in our jargon end organ function. More specifically, for instance, in order to cure early stage breast cancer in women, oncologists will administer antibodies against cancer. Yes, the cure rate went up for early stage breast cancer, but on the other hand, these antibodies may lower the heart's function in the long run. For instance, many types of hematologic cancers, such as lymphomas and Hodgkin's disease, will be treated with a combination of chemotherapy and radiation again, and this may trigger in the long run what we call second cancer. And it is therefore the kind of services this clinic will offer. It will offer services such as checkups, not only to make sure that you are cancer-free, but also to make sure that these treatments that you went through did not wreck any vital organs or will not trigger any other bad things down the road.
Is there also emotional supports in place? I've spoken to many survivors that they go through lengthy treatments, and now they've come out of their treatments, their life has been changed, and now they're looking for next steps. How does my life go on after the treatment? And does the clinic help them with those steps as well?
Yes, absolutely. And this is a very important point you are asking. Many times patients come to me and say that they have been abandoned once the radiation, the chemo is over, not because they want to go through these treatments necessarily, because the rate of the checkups or the rate of meeting with their health providers have been cut down dramatically. There might be a sense of abandoning. There might be a sense also of fear that the cancer may come back. Absolutely, also right from your part that some anti-cancer drugs, once again, let's name them, tamoxifen and others, may trigger depression, emotional disturbance. Some young women having early stage breast cancer may be pushed into a menopause state because of their anti-cancer treatment. And yes, these services will be provided at the Survivorship Clinic by either doing counseling or being referred to the appropriate health care provider.
Wow. How long has your clinic been operating already?
It's been only since March 2018, and we do have plans to expand.
Already?
I'm afraid, yes, the demand is there.
So you're obviously starting to see some success coming out of the clinic.
I think every patient that goes through the clinic is a success in the sense that unfortunately after radiation and chemotherapy your journey is not over. And this will fulfill needs to the population of Medicine Hat that went through these horrific treatments and hopefully continue their well-being through this terrible journey, having been diagnosed with cancer.
Absolutely. Now, does a patient need to be referred to the clinic, or can they just show up at your doorstep?
We try to make it easy for people. There is no need to have a referral paper from their doctor. We try to break down these barriers as much as possible, and just a simple phone call to the clinic will do.
Wow. And then I think the big question most everyone will ask is it covered by Alberta Health Services, or is there out-of-pocket expenses?
There is absolutely no out-of-pocket expenses as long as your Medicare number is provided. It is just like going to your family physician.
Wonderful. Is there any other success stories or anything else you'd like to share with us?
Yes, there is lots of possibilities at the Survivorship Clinic in the future, such as having eventually more programs added. For instance, one of the most terrible drawback from being in remission is feeling tired and lousy all the time. We call this deconditioning. There is more and more studies that's shown that exercise may help to fight this back. There is lots of other challenges and opportunities for this clinic to grow, such as providing to people what we call life change, lifestyle habits. Unfortunately, Heather, smoking still remains a terrible and bad habit. I am unaware, by the way, of a doctor who ever endorsed smoking. Having said that, there is lots of possibilities for the cancer survivorship to grow in the future. For instance, what is, in my humble opinion, extremely important is to give patients good lifestyle habits. For instance, once again, Smoking is such a terrible thing from a medical point of view. From a perspective of from an oncologist, if let's say you would have a major surgery to remove a lung cancer, if you continue to smoke regardless of the amount, it's not a good deal. Studies have been reporting, mainly from the National Cancer Institute, that your survival is less, that you are at risk for second cancers, such as head and neck, and of course, other diseases which I do not look after, such as heart disease, COPD, and strokes. Exercise is extremely important. And finally, the new kid on the block is alcohol. In April 2018, the American Society of Clinical Oncology and the FDA in the United States decided that alcohol causes cancer. And this can be found on the ASCO website. Of course, alcohol in moderation will always be a pleasure, but nevertheless, many epidemiologic studies have shown now that if there is a so-called increase of breast cancer in women in these ages, it might be because of alcohol consumption. These are the latest theories.
Fascinating. I didn't know that. That's a new study that was just released.
Yes, it was a panel of experts put on by the American Society of Clinical Oncology, which is an American panel that chooses world experts. It is endorsed by the Food and Drug Administration, and eventually the news is diffused to the medical community. And I must confess my own surprise, because as a Frenchman, wine is part of our culture.
Absolutely, absolutely. One of the questions I was just thinking about, so do any of the clinics, Medicine Hat and or the Calgary cancer clinics that our community would be visiting, do they know about your cancer survivorship clinic? Do they refer people, or do they suggest to people that they attend there after their treatments?
Yes, it is in the works right now. In the near future, you will see a change in the sense that there will be exploratory meeting between the Survivorship Clinic and Alberta Health Services, and this information will be eventually shared across the province.
Wonderful. That's great to hear. Is there anything else that you'd like to share with us?
I am very happy to call Medicine Hat home. I am very happy to provide this service to my fellow citizens, and I'm looking forward to meet with more people in this community and to make this vibrant community we call Medicine Hat really home. Yes.
Yes, thank you, Mark. We're very happy to have you here as well as your cancer survivorship clinic. It's going to be a huge benefit to our community for sure. So, Dr. Trudeau, can you tell us what types of cancer that can visit your clinic, or do you see at your clinic?
The kind of cancer patients that will come to the survivorship clinic have to be patients that obviously have survived their cancer and are in what we call in remission. Remission means that when a doctor examines a patient, may run some tests, there is absolutely no trace of this disease. I am a general medical oncologist now, and there is absolutely no restriction on the type of cancer patients that may come and knock on the door. Unfortunately, I am not qualified to see pediatric cancer. This needs a special training. This needs to be seen by specialized health care. And unfortunately, this population belongs to the children in Calgary. Nevertheless, if these kids survive their cancer and are in their adulthood, they're most welcome to come to the Cancer Survivorship Clinic.
So the clinic must you offer a number of services. So you're not doing this by yourself. You must have a team behind you helping as well. Tell us a little bit about your team. Who's all involved?
It would be impossible for one person to do everything, just like Barack Obama couldn't do it on his own at the White House. He had a team around him. At the Survivorship Clinic, it is like any other type of clinic. There is absolutely no restriction in the type of services that can be tapped into. And this is again the beauty of living in Medicine Hat. For instance, if surgery left you immobile from an upper limb, a post-mastectomy, there is networks of physiotherapists. Let's say, for instance, chemotherapy left your heart weaker than a normal person. There is now a cardio-oncology clinic in Calgary, and so forth and so on. I have already referred numerous patients to sex therapists because of their hormonal therapy for, of course, all kinds of treatments that need, all kinds of cancers, I should have said, that need this therapy. There is absolutely no limitation. Sometimes people ask me, well, will you be able to give me an X-ray, a scan, or even a PET scan? We do this on a regular basis. There is absolutely no limitation.
Wow. So you have a great big network behind you helping you with the Survivorship Clinic as well.
Absolutely, yes.
And do you think, or have you already been able to diagnose early cancer returning in some patients?
I'm afraid, yes, Heather. It breaks my heart to tell you that already on routine basis I have diagnosed recurrent cancer or secondary cancer. For instance, I have seen 2 or 3 young women. When I say young women, under the age of 50 or 60, that were sent to me for an assessment, a follow-up for their early breast stage cancer, yes, breast stage cancer, and I diagnosed them with a recurrence. Some had a recurrence in their bones, in their lungs, in their liver, and I had, unfortunately, to ship them back to the cancer center for more radiation, chemotherapy, whatever would be necessary to treat their condition. Yes, I did diagnose the patients with secondary cancers, such as leukemia post-radiation and chemotherapy for blood cancers, yes. It breaks my heart to say this. And other terrible conditions such as anemia, heart failure, and osteoporosis, yes. Actually, I am very happy to provide you with more information. I have reviewed in the last few months this number, and roughly 10% of patients will be either diagnosed with recurrent cancer or other life-threatening disease at the Survivorship Clinic. And when I reviewed already after 8 months of practicing, I submitted this research to the 4th annual conference of survivorship in Australia. This caught the attention of these people, and I will be presenting the results of my research this coming March in Sydney.
Well, that's wonderful to hear. Good for you. Congratulations.
Thank you.
So as a patient entering your clinic, how long will they continue to visit you? How long of a duration will the relationship between you and that patient, or is it ongoing?
There is a standards of care in every medical domain. For instance, if you have been diagnosed with Hodgkin's disease, there's virtually no point to be followed more than 5 years after the end of your anti-cancer treatments, because the likelihood of having your cancer coming back is too low. The same for testicular carcinoma. Unfortunately, things have changed for breast cancer. We used to say to these women after 5 or 10 years, you're fine, you don't need to come back and see us. Now there's a new standard. It's 15 years of checkups and follow-ups. Why does this exist or happens? It's because of what we call new epidemiologic studies. Epidemiologic studies are doctors that will study population. They may study AIDS, MS, Crohn's disease, but some leaders, such as the McMaster University in Hamilton, are leaders in Canada for epidemiologic studies and cancer, and they look at thousands of patients who had such condition, and that's how these guidelines come up. And it is our duty to follow them for the well-being of these patients.
That makes sense. That's wonderful. Dr. Trudeau, can you tell us why you started a survivorship clinic for Medicine Hat, or even how you came to learn about survivorship clinics?
Dear Heather, I am very happy to share with you the fact that as the time goes by, the medical community has learned more about different facets of cancer and how we can deliver, we hope, better care to patients. Medical oncology, radiation, and surgery has now found subspecialties. For instance, if we go back in time, it was only internal medicine doctors that would look after complicated situations. Now, for almost every kind of organ in our body, we will find a specialist, cardiologist, a nephrologist, lung specialist, and so forth. It is the same for the world of cancer care. As time goes by, the needs will change. We are living now in a time where the population is aging. The cancer community providers, such as myself, have realized that we have to do something about it. This was one of the first subspecialty of the world of cancer. It is possible now to subspecialize as a medical oncologist to be a geriatric oncologist. Why? Well, because your body at 75, 85 will not handle the radiation or the chemotherapy. The physiology of our body changes. One of the first leaders of subspecialty were our colleagues in the United States. Gynecology, oncology came, one of the first subspecialty. And how did I get involved in the survivorship aspect of cancer? It is very simple. I took a few years off and I needed to retrain to become a medical oncologist back in the community last year and training in a major cancer center down east, I was intrigued by their survivorship clinic, and that's as simple as that. I got hooked up to it. I thought it would be a very neat way to help people who went through this terrible journey of going through months of radiation and the chemotherapy.
So do you know any of the history that started that survivorship clinic in the East?
Absolutely. But before it started in the East, I am very happy to report that survivorship clinics started in the United States, maybe. It was the American Cancer Society that really pushed very hard to establish this subspecialty. Why? Well, because of the nature of the need these patients have. Radiation chemotherapy wears you down. It may wreck some organs. And the medical oncologist is just too busy. The radiation doctor is just too busy to treat cancer. This is where this new niche was struck. It's been around now for only 10, 12 years in the United States. I'm very happy to report that they are leaders. When I say they, the major cancer centers in the United States. For instance, if you are a patient at Memorial Sloan Kettering Cancer Center in New York, you don't go anymore to the General Cancer Survivorship Clinic. You go to the cancer survivorship clinic of the type of cancer you had. There's even now more subspecialized. There's cancer survivorship clinics for patients who had lymphoma, colon cancer, prostate, and the list is almost endless. The Europeans are starting to catch up on this. I had the chance a few months ago to meet a medical oncologist at the Guy and St. Thomas, the cancer center in London, that are starting one. And here in Canada, to best of my knowledge, we should be very proud of the Princess Margaret Hospital in Toronto. They do have a full cancer survivorship, of course, for any type of cancer, with full services. In Montreal, to best of my knowledge, they do have a pilot study. Yes, so far the survivorship clinic is only open for ladies that were diagnosed and survived their early stage breast cancer.
Wow. So you're almost doing groundbreaking work for us here right in Medicine Hat.
You are so kind, Heather. I must confess I like to be ahead of the pack.
Well, thank goodness you're here in our community then.
Well, I am very happy to call Medicine Hat home, and I will continue to help the people of Medicine Hat to best of my abilities.
Wonderful. So, Dr. Joe, can you tell us what the two most common questions that patients are asking you at the survivorship clinic?
With pleasure, Heather. The most common question patients will have for their doctor is, I am scared. My back hurts. I was more short of breath the other day. I'm afraid my cancer comes back. What can you do for me? And you know, Heather, this is totally normal. It's a terrible disease. It's always on the back of your mind. Each time there is a little ache, I'm not trying to minimize their symptoms. It is normal. It's not cancerophobia like some like to label it. It is normal to ask the doctor to be checked sometimes more often than the guidelines says, because it's a normal reaction. We want all to feel good. We all want to be reassured. And this is the kind of service a cancer survivorship clinic will provide. It is the duty of the doctor to listen carefully to their complaints, to examine them, and to decide on the appropriate investigation, which may mean simple blood tests, x-rays, to make sure that they are cancer-free and to help them to continue their journey through this experience of having been diagnosed with cancer.
Did they have two questions? Is there two main questions that patients ask?
Yes, there is another question at the clinic that comes often. After undergoing radiation and chemotherapy, not to mention surgery, to get rid of a cancer, many people will realize that they have to do something to get better. I see a dramatic shift in patients' motivation to take their health in their hands. And yes, this is where we can guide them. In my humble opinion, a doctor may be sometimes like a coach at the track, and I coach them how to do things. Unfortunately, the National Cancer Institute hasn't moved very far in terms of guiding people who underwent cancer or who wanted to prevent of having cancer. No need to say that some habits are not the right way to go, such as smoking. It leads not only to the development of cancer, but other terrible diseases. Secondly, alcohol in moderation. Third, nutrition. This is a huge topic. Unfortunately, the medical community hasn't been able to move away from telling people to eat at least 5 to 10 vegetables / fruits a day. Why? Well, this comes from old epidemiologic studies done in Africa that it lowers the rate of GI or gastrointestinal cancer. The new kid on the block now is, believe it or not, exercise. There is no doubt now that exercise will not only prevent cancer from coming back in subgroups of patients. There is no doubt now that exercise will prolong life in the general population, such as the Scandinavians have shown us, but also once you survive cancer. And we should be very proud to be Albertans. The Cross Cancer Institute and their team has shown with a partnership with the National Cancer Institute of Canada that mainly in women who have survived their breast cancer, people who had colon cancer, and if you do exercise, the likelihood of surviving your cancer is higher than just sitting and watching TV all day. There is theories why. The medical community just doesn't know why, but it works. And finally, I know this sounds silly, but please have safe sex. Unfortunately, some diseases, such as STDs and others, carry viruses that may lead to cancer. And a classic one is cervical cancer in women. Some sexually transmitted disease, and this is something found maybe 20 years ago and pushed again by the CDC. The Center for Disease Control in Atlanta has discovered many years ago. And finally, I thought it was finally, The sun, our best friend. It seems now that it's not our best friend anymore. Australians are leaders and basically would ask us to live in the shade if we could for the rest of our life because the most common cause of skin cancer is sunbathing. And I am very happy in the summertime now when I do my jogging on the numerous beautiful trails in Medicine Hat to see more and more people using sunscreens, wearing a hat, long sleeves. And no need to say that sun tanning parlors have made the news a few years ago. I'm not telling you they should be banned, but they are obviously carrying a health hazard as well for skin cancer.
Wow. Thank you, Dr. Trudeau. Thank you for joining us today. For more information, please visit the Riverside Medical Center's website, and you can learn more about the Survivorship Clinic. For Health Matters, I'm Heather Back. Thanks for watching.